cardiac arrest. He's very, very agitated. Are you okay, Charlie? Yeah. The adrenaline went in at 26, okay. Almost 2 minutes. We don't need the propofol infusion at the moment. Yeah, just leave there.
Do they drop me going?
What's its full name? Ivan Conyon. Okay, shout at 2 minutes for you, Tunde, for me, please. Thank you. 2 minutes, okay, so... No, I've got no output there. No, okay, carry on. No, carry on. He's had an out-of-hospital cardiac arrest, had CPR started in the community. I think he was in the pub at the time. He's been very drowsy when he came in, very agitated, and then he's had another cardiac arrest. So shout out when it's 2 minutes again. Charlie, can you just pass me over another adrenaline, please, as well? Thank you.
I have a pulse.
You've got a pulse, right, fabulous, okay. Yeah, just stop for a moment, so, okay.
Can we do a blood pressure, please?
Yes, please. Just hold fire a minute because I would imagine he's going to arrest him in a minute. Okay, can we try and get a 12 lead now, please?
Yeah.
12 lead ECG, yeah, fabulous. Thank you. Sometimes when you've got a patient back from a cardiac arrest, they go into a different type of heart rhythm. They might still have a pulse, but the heart rhythm is wrong. Then you deliver an electrical shock, hoping to kickstart the heart back into a normal rhythm. Can we charge to about 120 joules? Everyone happy? Oxygen's away? Yep, so if you can deliver, charge, yep, please. Lovely, thank you. Okay, we've got an output.
This will make new hair grow where you don't have hair. Don't use too much because it will grow too much. This shampoo contains...
Can we charge again? Yeah, we've just increased up a little bit. I'm going to shock him again because he's in an SVT. Okay, yeah. Yeah, okay. Lovely. Thank you. We've got a very thready output.
No, I think there is. Can I have an ECG done, please?
Just bear with me just a second because I'm just having some difficulty feeling the pulse. Yeah, there is a pulse there. He's got a very poorly functioning heart at the moment. He potentially will have another cardiac arrest. So we're just trying to stabilise him as much as we can and then see how he goes. Will you let his family know that he's likely to be going to intensive care, but he's still very, very sick? I think it's unlikely that he'll survive because his heart function at the moment is only about 5% of what it should be. He's obviously reasonably strong. He's managed to survive 2 cardiac arrests this evening, so you can never say never.
He was taken to the intensive care unit and placed on a ventilator. So he's been very fortunate indeed to have got through that first episode. He's proven to have severe coronary artery disease plus these ongoing arrhythmias. I think he's still in a dangerous state and we're not prepared to let him go home because our fear would be that he would have another cardiac arrest and die.
Nice to see you again.
Hello, Scott. Nice to see you again. Our plan is to do an open heart surgery operation, a coronary artery bypass graft where we bypass the blockages in your coronary arteries. There is some risk with this sort of major surgery. Maybe the risk to your life is somewhat higher because you came in such an ill state. And also you're getting this dangerous ventricular rhythm, which is of concern.
If I didn't have it done, there would be nothing else you could do for it, would there? It's got to be done, hasn't it?
We think it is best to take it on and get on it.
I just want it done. I just want to get it done and see where we go from there.
Oh, I'm content that it's the right thing and we're doing it to make him better.
Daddy's.
We certainly do let the patient and the next of kin know that there is a real risk with this sort of major open heart surgery.
And drop your head down a little bit, sweetheart.
When one's doing heart surgery, the stakes are high for every patient. Okay, turn the lungs off, please.
Lungs are off. Okay, lungs coming back on.
Lungs back on. The spreader first. What we are doing is not to treat the disease in the coronary artery per se. We're bypassing the blockage. In the same way, if you have a congestion in a city centre, you might build a bypass around the town to relieve the congestion. Scissors, please. On the leg, there's a vein, it's called the long saphenous vein, and we're going to take it out and use that to bypass the blockage in the coronary artery. You can see the vein and carefully remove it without damaging it. Okay, blood in the syringe, please. I think it's okay. It's great. Soon we'll be able to have a closer look at the heart and particularly look at the coronary arteries. Big dry swab, please.
So this is a critical step he's going to do now.
Okay. Push down hard on that pipe. So it's,
This is in preparation to go on cardiopulmonary bypass machine. Okay.
This is one pipe that's going to bring blood back from the machine into the patient. And we're going to put another pipe in to drain blood away from the heart. And it then becomes possible to stop the heart for an hour or so to do the operation.
Yeah.
Wind in from the pump.
Just 1 second, Mr. Ridley.
I can't take any blood into the bypass machine at the moment. To go onto the bypass machine, we require it to be above 440 on this particular machine. One's going off at 323.
In order to do the operation, we have to give the blood thinner, and it's being given in the calculated dose, but this patient's got some resistance to the anticoagulant. We'll see what the test shows because we need it to be satisfactory before we go into cardiopulmonary bypass.
The other one is still counting, we're at 340.
Could going to church be the step that brings you closer to God? Church is one of the best places to connect with.
The patient isn't adequately anticoagulated and we go on the bypass machine, there is a potential for it to clot up on the machine, which would be disastrous.
Worst case scenario, that could lead to a life-threatening situation. To cancel the operation now at this stage would be a major setback. His heart would be in the situation we were in before the operation, and he'd indeed been in a somewhat worse situation than when we started.
I'm just making sure every bit is gone in and we have a best chance so that this heparin can act.
In an ideal world, we could do with the activated clotting time coming to a reasonable level and progressing with the operation as was originally planned. I think, touch wood, we're there. Okay, 440.
Okay. Can we
And
give a
still
call to
counting.
Mr. Quigley?
We are now happy with the level of anticoagulation, so we can continue with the operation.
Yeah, we are ready. Yeah. Yep.
Well, this is really good news, this is. And the next thing we're going to do is stop the heart and rely on the bypass machine. And then we'll do the bypass grafts, which is the substantive part of the operation.
Okay, we are fully on bypass now. Cooling to 34.
Okay.
I've found one of the coronary arteries and made a little hole in it. And with fine sutures, we're going to sew the vein that came out of the leg onto that artery. A mastoid, please. This can only do him good, this one. Yeah. It's quite good. It looks like that's about the length of it to there, doesn't it? So we can put the rather thicker end on whatever. This is the main part of the operation of the coronary artery bypass graft. Scissors, please. This one's been a little bit more technically difficult, but it looks good. All right, haven't I? I've done it. Okay, that's enough, I think. So down on flow, please.
Flow is down.
Backed up, please. Cross lamp is off.
Thank you. Coming back there.
Okay, we've got a reasonable rhythm and we can pace if need be. Okay.
We are good.
Looks good. Come off bypass at that, please.
Okay, we'll do coming down to off, and we are off bypass now.
Our first impression is this is satisfactory. We're now off the bypass machine, so he's making his own blood pressure. The next step will be to close the chest. We made important first steps, but he is not out of danger yet. He's got to be carefully transported to the intensive care unit. Maybe by tomorrow morning I'd expect that he'd be off the ventilator. I mean, I hope that his heart rate stays dead steady now. It is possible if we've got more blood to the heart. That was the idea, but so far so good today. Afternoon, Mr. Conyon. You were out of bed for a little bit a few hours ago and sat in a chair.
Chair, yeah.
How did you find it?
Being in a chair again, it's magic.
Well, we're pleased with you overall. The blood pressure is quite satisfactory.
Yeah.
And your heart rhythm is steady.
Yeah.
It's nice to see you're off the ventilator.
Yeah.
And then we'll aim to get you moving more and more each day.
I just want to get home, as soon as possible. That's my aim.
Good for you.
Okay, thank you.
I'll see you later. Bye-bye.
Thank you. Well, I woke up and I didn't really realise where I was.